Well, I'm nominally the lead clinician, and my job really is to make sure that what we develop here will benefit the children in this country maximally. So the development of high care and intensive care and surgical facilities have sort of fallen off the table a little bit within the last few years, and we've got good vaccinations and we've got good level 2 care. But when you've got leukemia or when you've got a hole in your heart, what you really need is a surgeon, not a vaccine, or not malaria bed nets. You need, and we've got the skills in this country. We've got the surgeons, we've got the pediatricians, we've got the nurses who can look after the children, but we haven't got the facilities. There's some 300 and something children waiting for heart surgery in this town alone, and the queue never gets longer because of attrition. They die while waiting for the operation. So we need to have intensive care beds. We need an imaging system that can make the diagnosis for these children and can get them ready for surgery. We need pediatric anesthesia to provide it. And most of all, we need nurses. And this hospital is going to do that. It's going to provide the if you like, the top of the pyramid that is a bit shaky.
I mean, it's unbelievable. So at the end of the day in South Africa, we don't actually have a specialized hospital for children at all.
Well, Cape Town's got the Red Cross Hospital. We shouldn't forget that. But in this whole region, the next children's hospital is in Kenya, and that's a very small one. And then there are 2 in Cairo. But that's it. Whereas in America, each state has got numerous children's hospitals. Children get lost in big hospitals. They're not given. We pay lip service to them, but children sit at the back of the queue. And so when we have children treated in a general hospital like the one over the hill here, okay, they're lost in that and they're not prioritized. Whereas in their own hospital, they will be prioritized. The physiotherapy will be a pediatric physiotherapist. The surgeon will be a pediatric surgeon, and we have such needs.
I mean, this is vital for South African healthcare and for the healthcare of children. Do you find that other countries in the world, I mean, do they have much more specialized healthcare for children? Is this a massive gap that's missing within our healthcare system in South Africa?
Absolutely. It was a tragedy because we were going along the route of having specialized hospitals for children 30, 40 years ago, and then we lost the plot, I think. And we thought it would be more efficient to have everybody in one big general hospital. But now we realize that this priority has to be recreated. We have to try and create it. And the ethos of having a children's hospital like the Nelson Mandela Children's Hospital will spill into the care we give outside and beyond. So this hospital will be regional, and we will then influence the way that children are treated by our referring hospitals and by our neighbors. Mozambique, Malawi, Botswana are all going to use the facilities of this hospital.
Are you going to, once that dream is realized, you will be there? You will be working at that hospital?
I'm 400 years old, plus minus. So my job, I see it, is to take this thing into fruition. Now, what we need to do is we need to appeal to the people out there and say, give, because we need to break ground. We need to start building this hospital so that we can get it functional. Once I see that happening, I'll fade away as a retiree and disappear into the dust.
I have another job for you, though, because I know that our kids out there are watching and saying, is that Father Christmas? Is that Father Christmas? I think that could be it. I mean, when all else fails, Prof, I think Father Christmas, that could be the next career for you.
Leanne, because of my natural appearance, I've been Father Christmas more than 100 times over the last 20 years. The children see me in the street, they stop dead in their tracks and ask me, and I promise them the world and whisper in the parents' ears what they want. Okay, so yes, but the trouble with Father Christmas, it's a very seasonal job, and I need to fill in as a pediatrician between January and November, so it's very seasonal.
Not sure how much money Father Christmas makes either. Listen, Prof, thank you. Keith Bolton talking to us. He's a pediatrician, talking to us about how essential it is that we need one of these hospitals here in South Africa to treat the children of not only South Africa, but also some of our neighboring countries, talking about Southern Africa as well.